Welcome back, friends, to the Guaranteed Analysis podcast. I'm your host, Kim Wilson. Danielle is not going to join us today. I'm going to do a solo cast. And thanks for joining us again while we break down companion animal nutrition into bite sized pieces everyone can chew. So today's topic is going to be all things vet tech, and why we're such a big integral part of the veterinary team. So, some highlights that I'm going to cover today are: what is a vet tech and what are the roles that we play within the veterinary field, the differences between what a vet assistant is, a veterinary technician that is licensed versus one that isn't licensed, a veterinarian, and I'm even going to cover a little bit what a vet tech and a nurse have in common, a human nurse have in common, and what they have that's different. I'm also going to go into what the advantages and disadvantages are of being a vet tech and what kind of jobs that we can work that aren't just within the clinic space. And then I'll also cover a little bit about what it takes to become a veterinary technician specialist. So let's start. What is a vet tech? So, like I said, we are integral members of the veterinary healthcare team, and we are mostly responsible for supporting the veterinarians. We have theory and practical skills that are essential for the overall medical care of animals, but we do tend to wear lots of hats. There really isn't much within the medical space and veterinary world that we don't have our foot in or, assist in some way. We're probably the most fluid people in a clinic. We can really touch on everything, and our job roles are a little bit more muddy than, say, a veterinarian or a client care staff member. Our biggest role tends to be the being a liaison for the veterinarians. So I do like to call us sometimes like the mom and dads of the veterinary team, because we are such a touch point from every single direction. We are liaisons between the owners and the veterinarian, the front of the house staff and the veterinarian, um, even like drug representatives and the veterinarian. And we're kind of in charge of making sure that everything is smooth sailing within the veterinary space. So making sure that the vets get to their appointments on time, that they don't, book so much that the rest of the team can't keep up with that. Just kind of keeping everybody on time, making sure that things run smoothly. That's a lot of the time what a vet tech does. So, yeah, there's a lot that we do. We're very, very versatile. So, I'm just going to touch quickly on the difference between a veterinarian and a vet tech. It's pretty obvious, just, like a doctor is not a nurse. The main difference between a veterinarian and a vet tech is that we cannot diagnose, prognose, prescribe, or perform surgery. Those are all limited to a veterinarian with a license only. We can assist in those things, but we cannot do those things, or get in a lot of trouble. And then the other obvious thing is the fact that veterinarians go to school for a very long time, and vet techs don't tend to go to school as long. They can, depending upon what kind of schooling they want to do. Uh, but that's usually kind of their own personal journey. It's not a requirement the way that it is for a vet. So, what did vet techs do within? I'm going to mostly talk about the clinic space. I could go off on a bunch of tangents on, what else we could do. And I will touch on some other jobs that we are qualified to do. But for the most part, I'm going to focus on, what do we do when we work in clinic alongside veterinarians? So, one of the main things is we provide husbandry, restraint, and handling of the animals. So, what's husbandry? That's basically taking care of them and making sure they're comfortable while they stay in hospital. So that's making sure they have a comfy bed, food and water, taking them out, having a litter box, all those kinds of things. Um, we do have vet assistants to help us do these things as well. So even though we may not be the ones always performing these roles, we're typically the ones that are in charge of making sure that the animals are comfortable, they get outside, and that kind of thing. The other thing is restraint and handling. So vet techs are very gifted in restraining animals so that the animal doesn't get hurt and the people working on the animal don't get hurt. Vets are trained in this, but they tend to be playing the role of doing whatever procedure or whatever diagnostic needs to be done on the animal. So they're not usually the ones holding while they can do that and they're taught how to do it. The techs tend to be the masters of this. You always had a person when I worked in clinic that was the cat person. Didn't matter how mean this cat was, this person could hold the cat effectively with minimal stress, and everyone could get their job done with little stress to the animal. And they were the cat person. And it takes a lot sometimes to be really good at restraint because there is a little bit of a fear level there, but that's typically a vet assistant or a vet tech job. The other thing that we do is anesthesia. So we're involved in creating the protocol, delivering the anesthesia, monitoring the anesthesia, and recovering the animal after anesthesia. So it's a pretty big job, and it's really in depth. So we don't typically create the protocols by ourselves. You usually help the veterinarian with that, but the delivery, monitoring, recovery, that's all us. And we learn how to do that in school. It's my second favorite thing to do in as being a vet tech. Nutrition first, and then anesthesia. It's really fun. Um, the next would be surgical prep and assistance. So we get the surgery packs ready, maintain the equipment, maintain all the tools and everything like that, make sure that the surgical suite is stocked with everything that needs to be used while in surgery. We do the surgical clip and scrub. So, because animals are hairy, you have to shave them down and then you scrub them to make sure that they have as sterile as an area for the vet to work on. We also do positioning. So, whatever, if they have to be on their back because they're getting a spay, they have to have their leg up because they're having their knee fixed. We prepare all of that before the surgeon even comes into the room. We also assist in breeding and reproduction procedures. So this is less common, and I don't know as much about it because I haven't really been involved in it. But things like IVF, and I think all that's done. It's done a lot in large animal. There's a lot more breeding and reproduction when you work in that area, but it's something that the vet techs are very involved in. Another thing we do is client relations. So, again, with the many hats, we also will answer phone calls and emails while we, try and offload the conversations and communications that are happening between the outside world and the veterinarians. The vets have enough on their plate. So, if we can kind of, you know, monitor that and do our best to alleviate that influx of questions or anything like that, because a lot of things that are coming through in a communication sense as a vet tech, because we have the theoretical, the knowledge to talk to the owners about this, a lot of the time we can answer a lot of questions without having to add to the veterinarian's workload. So we kind of deal with that as well. The next thing we do is drug and fluid calculations and medication administration. So we calculate how much of a drug needs to be given, how much fluids need to be given, whether this is IV drugs, IV fluids, oral drugs, sub-Q fluids. We calculate all of that. Most places will have multiple people calculating this so you make sure that you don't make a mistake. And oftentimes the veterinarian will give you, what they want, but there's always second checking happening. And also, you need to know that if someone made a mistake, you kind of need to have an idea of, oh, that sounds like too much. Or so if you don't have these practical skills to calculate drugs and fluids, you can't catch these little mistakes because we're all humans. And sometimes you get too busy and you accidentally add a zero on the end of something or forget a decimal point. So that's something that, is mostly put on the vet tech shoulders because we're the ones administering it. We're the ones hooking up the IV, getting the bag of fluids, getting the medication, and doing it all. So it's really important that we know how to do these calculations. Another fun thing we do is x-rays. So we're in charge of all of this. Veterinarians will sometimes help to come in and restrain and position and that kind of thing. But they're mostly in charge of reading the x-ray. So the vet techs will do the positioning to make sure that the right area that we're looking at is going to get caught in the picture. We also calibrate the x-ray machine to make sure that the settings are right. 'Cause it is very much like taking an actual picture. You want to make sure that you're not going to get too much light or not enough light. We're also in charge of the maintenance of these machines. Usually, the veterinarians don't do much for the maintenance of uh, the equipment that's being used within the hospital. We also restrain the animals while the X-ray is being taken, and we take the picture ourselves. So it's it's a lot of fun. Can be a little bit annoying because some veterinarians will want a lot of detail, and like you'll have this animal that is very hard to restrain and you didn't get the right picture. So it can be fun. It can be a little bit of a struggle. Another thing we do is phlebotomy, or taking blood and obtaining samples for different diagnostic tests. And then on top of that, we run the diagnostic tests. So we will place IV catheters as well, um, do blood draws, and then take that blood, or urine or cytology and run it in an in-house machine. We can send it away to a lab to be run, but when you have an emergency or somebody who wants to know the answer right away and not the next day, there's machines that are in-house that you can run blood and all of that on, and it's done by the vet techs. The vet techs can also collect urine, so there's certain ways that you can collect urine that are not just what's called a free catch, where they just pee into a cup. So we do that usually as well. And then cytology. So things like an ear swab, and we look at it under the microscope. Or if there's a lump and the veterinarian gets a sample, a lot of the time the vet tech will do a preliminary look because there's a lot to look at usually under the microscope. So the vet tech does the first look and the vet comes along and takes a quick look after. The next thing would be dental cleanings, which is known as a COHAT. So, what that stands for is a comprehensive oral health assessment and treatment. And as the vet techs, we're very involved in this. I have to be honest, it is not my favorite thing. And I have maybe done 5 in my entire life. So, what this entails is the mapping of the teeth, cleaning of the teeth, and radiographs. So, you, as the vet tech, will either be doing anesthesia or the dental cleaning while the vet does anesthesia, and then you switch out. So, vet techs actually probably do more in a dental cleaning than a veterinarian, depending upon how dirty the mouth is. And last but certainly not least is nutrition management. So vet techs do a lot of the nutrition management, which is partly why got so interested in it. So they do things like feeding calculations to make sure that your pets are getting the right amount of calories, and this includes weight loss programs and management. So they'll figure out how much to feed for your pet to lose weight and then monitor that throughout. Uh, they also will assist the veterinarian in selecting clinical diets. Typically, it is the vet techs who are also in charge of the inventory of the food. So they kind of also know, what's in stock, what's not in stock. Um, they also get to talk to the owners more than the veterinarians to know whether these diets are working or not working. So the vet techs have a lot of experience with dealing with diets. So they get to do that. And then probably one of the biggest jobs if you work in a hospital that you have animals that are staying for extended periods of time is getting hospitalized animals who are sick to eat. That probably was about, I don't know, 50% of my job when I worked in the ICU. It was just feeding animals and trying to figure out how to get them to eat because a lot of the time that was one of the reasons why they couldn't go home. Because if they're not eating in the hospital, then they're definitely probably not going to eat at home and then they'll just come back. So that was always a master goal when I worked in the ICU was making sure these animals were eating on a consistent basis, not just kind of, giving it a couple licks. So that took a lot of my energy when I worked in the ICU. Okay, so those are some of the things that that tech can do. Like I said, we wear so many hats. So that was just an outline of most of the jobs that a vet tech does within a clinic. There's lots of stuff that we do, and there's also lots of different levels that you do it in. We always have an affinity for things. So some vet techs are not going to like anesthesia as much as they like doing wellness exams or surgery and that kind of thing. So we always kind of lean towards what we like, which then usually becomes what we're good at. So there's always this kind of ebb and flow of vet techs within a hospital that, this person's really good at this and it balances out. So now I'm going to talk to you a little bit about what the differences are between a veterinary assistant, a licensed veterinary technician, and a non-licensed vet tech. So, a vet assistant is somebody who basically assists and makes everyone's life in the hospital easier. They are my favorite people because they often get the crappier jobs that are just as important as everything else, but are either monotonous or dirty, like cleaning up poop or whatever. But because they don't have the same background as vet techs and vets, they need to be focused on doing the jobs that they are qualified to do. And unfortunately, the ones that are left tend to be the jobs that people don't really like to do. So that's what the vet assistants do is they help out with those jobs. And I can't even tell you how much easier my life is when I have a vet assistant. They're wonderful. They're my favorite. So you can be on the job trained for a vet assistant or you can go to school. I believe it's kind of like a 1-year program, maybe 2, depending upon where you go. A lot of people take it to kind of see if they even like this world. It's can be a stepping stone, or some people just are happy to do it. Like I said, they have less responsibility than a vet tech and a vet, mostly doing things like walking the dogs, and they do administrative work as well, answering phones or doing scheduling or that kind of thing. And a lot of the time, this will lead into becoming an on the job trained vet tech, or some of them will go back to school to become a vet tech. So it tends to be, you're starting out here and you work your way up. So yeah, love my vet assistants. They're amazing. So shout out to all the amazing vet assistants that I've worked with. I love you guys. So trained on the job vet tech versus a licensed or vet tech who went to school. So the main difference obviously is that an RVT, LVT, or CVT, they have a letter next to their name that indicates that they are credentialed versus a vet tech does not have that extra letter next to their name. Most places you will need to go to a school that is recognized as a valid program to be eligible to get licensed. So these schools are either a diploma program, an associate degree, or a bachelor's degree. Unfortunately, they are all kind of seen as equal across the board, but they do not require equal things. So a diploma and associate degree are a 2 to 3 year program, and a bachelor's degree is typically a 4 year program, but they're all sufficient to get credentialed. And while some places may recognize that you have a bachelor's degree over a diploma, for the most part, all they care about is that you're credentialed, not what you did to get there. So while, it's like, oh, a bachelor's degree, it's 4 years, it's going to give me a lot more, which it does. Once you get into the field, I wouldn't say, like most bachelor's degrees, that it separates you the same way that it would for a different profession. It's unfortunate, but that's just where we're at right now. Personally, I think you deserve a lot of credit for going to do a bachelor's degree, and I really wish I could have, but that wasn't available to me. Um, the next thing that is required, and I don't know if this is required for every state or province, but it's an ethics test. So you go and you take a program and pass a test to show that you have a sense of ethics, because we are working with living creatures, we're working with people. There is a lot of ethics involved in the job. And so for me to get credentialed, I needed to prove that I had a sense of ethics. I'll just take a back step here. Something I forgot to mention is each state or province is in charge of their own credentialing, and they have their own bylaws and rules and regulations that you need to abide by to hold that credential. So it's not an overall national thing, it's individual states or provinces, and you have different scopes of practice and rules and requirements within each state or um, province. Okay. The next thing that you have to do is you have to take what's called the VT&E, or the Veterinary Technician National Exam. Now, this is something that is across the board. I don't know of any state or province, and someone can correct me on this, that doesn't require you to take this exam to be eligible for credentialing. So I know that for you to be eligible to take the VT&E, you typically need to also have a um, a degree or a diploma. And however, there is one state, Wisconsin, that will allow you to take the VT&E through them as long as you have been a vet tech for 2 years and 50% of your time as a vet tech has been completed with a practical application, meaning holding animals, providing medication, and that kind of thing, not things like research or administrative work. The other 50% can be comprised of that, but you can't be working in a vet clinic and be mostly a receptionist and then do a little bit of vet tech work. It has to be a 50-50 kind of thing. So let me just back up again. Most places will need you to have, actually, all places except Wisconsin need you to have gone to school at an accredited school and received the degree, and you have to complete and pass the VT&E. There's other little things too that, like I said, the ethics test you may have to complete, but they're typically smaller. And then obviously you have to pay dues and a membership to be a part of it. So once you pass the VT&E and you've gone to school and you've done all these things, you're eligible to become a member. And then once you become a member, you then have to follow their bylaws, pay their member dues, and most places, actually all, I'm pretty sure, you need to complete yearly or bi-yearly continuing education. And this is true for even veterinarians and pretty much anybody in the health space. because science is moving and changing so much, you want to stay on top of it. You don't want to keep using the same drugs or belief systems that you've been using 10 years ago, because the chances are that that is potentially no longer true, or that it's evolved in some way to progress. And so taking continuing education is one way that these governing bodies ensure that you are not staying stagnant, that you are continuing to learn about what's new and up and coming, and are, up to date on the most progressive, as much as possible, science and treatment plans and things like that. So that's kind of the difference between a vet tech and a licensed vet tech, is that they've gone to school, they have passed the VT&E, and they hold this credentialing within a province or state. When it comes to the actual job, though, and what they're delegated to do, there is recognition for licensed vet techs, in the sense of they tend to be more sought after. They probably will get paid more, again, like more than a regular vet tech without credentialing, if they have the same experience. This, in my experience, is not true if the vet tech that they've hired is not licensed and they have a lot more experience. That vet tech will get paid more than, say, a new licensed vet tech. Hope that makes sense. Uh, And then in terms of the jobs that they do, it's pretty much the same across the board. A vet tech that is licensed doesn't necessarily have more responsibilities than a vet tech that isn't. In fact, in where I am licensed in Ontario, as of right now, I have less responsibilities than some veterinary technicians based on experience. So my licensure says that I cannot perform dental extractions and like neutering of a cat, or things like that, like minor surgeries. But the law indicates that a veterinarian can delegate um, tasks to any lay person that they see fit to perform the task, and they take full responsibility for that action that that person does. So Uh, as a vet tech, though, I'm not allowed to be that person, because I have more schooling and theoretical in the eyes of the law. So while a person who is not licensed could maybe do a dental extraction, and it's on the veterinarian to, if anything goes wrong, it's on them, not the person who is told to do it. But me, as a licensed vet tech, if the vet told me to do an extraction, which I know I'm not supposed to do, and I do it and something goes wrong, then not only is the vet kind of on the hook, but I am as well. So sometimes it's a little backwards. Sometimes it's a little backwards. But for the most part, vet techs that are licensed have more experience in terms of theoretical knowledge, and just things that they did to get accredited. Okay, so now we know the difference between a vet tech that's licensed and not, and a veterinary assistant. I'm going to talk a little bit about the differences between a human nurse and a vet tech. Um, I definitely don't want to offend anybody. This can kind of be a little bit of a hot topic, but I think it's important to cover, just so that we can get some clarity, and so that people can understand the clarity between why we don't do things like nurses do, or we do things like nurses do. Um, and I hope that I'm speaking from a good place. My mom is a retired nurse, and I did make sure that I went over, a lot of these things with her to make sure I got it right. So, yeah, if I get something wrong, please feel free to let me know, and we will correct it. But for the most part, it's a good thing, because we're both very similar. Uh, the main difference that is obvious is that we treat animals and they treat humans. But our scope of practice in how we go about this, and our hearts for sure, are very, very congruent. So I'm going to go over the similarities first, and then I'll go over the differences. So, similarities is patient care and advocacy. It's a big one. That's pretty much the biggest job that nurses or vet techs have is you take care of those patients and you advocate for them because you are so entwined in their care. The doctors are there for their care and they do a lot, but you know, they have a lot on their plate, and a lot of it is in some ways, looking at diagnostics, coming up with a plan. They don't get to spend as much time with the patient as vet techs and nurses. And so that is a huge part of a similarity between us. Like I said earlier, when I was going over the jobs of the vet tech, we do drug and fluid calculations and medication treatment and administration. So do nurses. So that is a big overlap. We're in charge of those things. Even though the doctor orders it and prescribes those things, we are the ones giving it to them. We also have client and patient relations. So as vet techs, we have clients and patients. And maybe in the US, it's also a client and a patient, but here in Canada, it's mostly just patients because we have free healthcare. So we're the ones talking to the patients, usually going over discharges and talking to them about how to take medications and their overall well being. The doctors don't typically do that, the nurses do. So both of us are in charge of those things. Another thing would be anesthesia recovery. While the vet techs, we do, I think, a little bit more anesthesia. Although my mom did inform me that, especially nowadays, nurses are a lot more involved in anesthesia than they used to be. We both do recovery. So once they come out of surgery, we make sure they're comfortable and that they're waking up okay, that they're not in pain, that they're going to the bathroom, that all these things are working. That is a nurse's job and a vet tech's job. We both also do emergency triage. So when you are working in the ER, a lot of the time the nurse will do the intake and help decide where you fall within the line of needing to be treated. So both nurses do that and vet techs do that. And then the last thing that I could think of, and I'm sure there are a lot more things, but this is just, a general overview, is surgical prep and assistance. So, like I went over before, getting all those surgical equipment ready, making sure the patient is ready, doing a surgical scrub, handing the tools and instruments to the surgeon, just being involved in the surgery but not performing the surgery. So those are the similarities between a human nurse and a vet tech. Now I'll go into the differences. So I'll start with the differences in schooling. uh, we both have to go to school theoretically, although vet techs can be trained on the job. If you want to get registered, you typically can't do that, or it's a little bit harder to get registered without the schooling. Now, nurses, from what I understand, cannot be trained on the job and become RNs or registered nurses. They have to get a bachelor's degree. And I don't think that there is a associate's degree or a diploma that allows you to become an RN. I know you can become a RPN, or a registered practical nurse. I think that's what it's called. But if you want to become an RN and be registered that way, you have to go and get a bachelor's degree in nursing. And so that can be different school times. So you could go to school to be a vet tech in 2 years, whereas if you want to be a nurse, you got to go to that 4-year course. And then within our scope of practice, it is a little bit different. Obviously, like I said, the main difference between nurses and humans is that we treat animals, but we also treat multiple species. So while a nurse treats humans, we tend to have knowledge across the board. So knowledge in horses and cows and cats and dogs, and maybe even some pocket animals like hamsters or rats, birds, exotics, and that kind of thing. So while you tend to go into a niche direction and do like mostly cats and dogs, when you're in school, you learn about all these animals. So you learn about large animals, you learn about pocket animals, you learn about exotics, and you learn about cats and dogs. So, and depending upon the clinic you work at, you may be exposed to all these things. So you may have to know all this. Whereas human nurses, they get humans. It's a lot more in depth in a lot of ways, and you need to know a lot of more about humans. But um, it it's hard to kind of flip flop between those species of like, oh, I'm treating a cat now, I'm treating a dog now. So that's one difference. The other thing is, like I said earlier, the anesthesia. So we are involved in creating the protocols. We administer the anesthesia, we do the monitoring and recovery. Now, I don't know the level that nurses do this now. I know it. My mom said when she was practicing, it was not something that nurses really did, but I think now they have a little bit more of a role in it. To what degree, I have no idea. But from my understanding, for the most part, if you have say, a very high risk surgery, it would be an anesthesiologist doing this, whereas it's not necessarily an anesthesiologist doing high risk surgeries within the vet field. If you are lucky and have an anesthesiologist at your hospital, great. They are definitely involved, but not everywhere has that luxury. And so it's the really advanced, skilled vet techs that are doing these surgeries. The other thing that nurses don't do is dental cleanings. That is reserved for our beautiful dental hygienists. So they don't need to do that, but vet techs do this. The other thing would be x rays, MRI, CT. Those are typically all run by veterinary technicians. And in human medicine, that's a completely separate degree or diploma. And you have MRI technicians or CT technicians, x ray technicians, ultrasound technicians. These are all people that do that within the human space, but in the vet space, the vet techs are often doing it. The second last thing would be running lab tests. So, like I said, running the blood work, running urinalysis, looking at cytology under the microscope. In the human world, these are all sent away and done by separate lab technicians. And at times, that's something that we do. And the last thing is phlebotomy. Now, I know that some nurses do it. And actually, this is probably one that should go under the similarities because I do think nurses like place catheters, they draw blood. But the difference would be that if I go get my blood taken, I usually go to like a blood lab where they have people who are basically just drawing blood all day. Where in the vet space, you come to the vet clinic and the vet techs will draw the blood. There's not a separate space for you to go that is just drawing blood. So I know nurses can do this, and they do, but typically when you get blood work, you go to a phlebotomist. It's a little bit different. You just go to a vet tech. So, now that I've gone over the differences and similarities between our lovely nurses and vet techs, there's a question that will often come up that I get a lot, and it's why are we not called veterinary nurses if there are so many similarities to human nurses? And the reason for this is a little bit complex, but the main reason is that the term nurse is a protected term in most countries, meaning that you cannot call yourself a nurse unless you have become credentialed as an RN or are working with humans, basically. So I don't really know the ins and outs of like the law around this, but I know that nurses have their name protected. And it's basically illegal for you to say, I'm a nurse, and you're not a nurse. um, so that's the main reason why. And which begs to question, then, okay, well, what about vet techs? Why isn't their name protected? And the answer is it's in debate. We as a community are looking hopefully to have our name protected, but it comes with a lot of debate and uncertainty because we still have veterinary technicians out there that are not credentialed. And so what does it mean for them if we protect the name? Because they're technically not the same as a vet tech that has become credentialed, but they're also not lesser than. And so we have to have a way that they also get the acknowledgement, respect. A lot of these people have been working in the field for like 20 plus years, and they are just as skilled as any vet tech that has gone to school, taken the VT&E, and been working for the same amount of time. So I'm kind of on the fence of, do we protect this? What do we call ourselves? Because there are some people who want to ride on the back of nurses and they want the name nurse because nurses are respected and people, know what they do and have faith in them, but maybe don't show that same kind of appreciation for vet techs. In terms of what we're called, I personally don't care because if we do enough education and outreach to educate the people outside of the vet clinic to know what we are, then we can do that for ourselves because that's what the nurses did. They put in the work to earn the respect. And so I'm fine to do that. Whether we get protected or not, I sway both ways. I think both sides of the argument are valid. Um, I think that the on the job trained vet techs need to have a way to become credentialed if this is to happen so that they don't lose out on the benefit of having that name protected because I don't want them to be less recognized. But I do want the appreciation and respect that might come along with having our name protected so that people on the street can't call themselves a vet tech. And, this comes with pros and cons. It's likely going to be more regulated. The scope of practice may become more ironclad. So, we may have to give up some things that were benefits to the job, but we also may get some benefits because our name is now, strong again and not just kind of thrown out there to whoever wants to use it. So it's there's good and bad things. And I'm just excited to see where this job is going to develop and grow. I read something the other day about how they think there's going to be about an 18% increase in vet tech jobs in the next 10 years. So that's exciting that they see that. But yeah, we'll see. Uh, and moving on to, the development of this job, if you're maybe someone who is considering being a vet tech or, just wants to know what the ins and outs are and why people become them, I'm going to go over the advantages and disadvantages. So I'm going to start with the disadvantages. I'm going to give you the caveat that the disadvantages are more numerous, but their quality is not as good as the advantages. And I say this because if you were just listening, purely on a like just list these things off, you could argue that there are a lot more disadvantages to this job. But I really truly feel that anybody who truly likes being a vet tech, yes, maybe I can't list as many advantages, but those advantages are so much higher in quality and are so much better than the disadvantages that it makes it all worthwhile. So we'll start with the disadvantages. So, disadvantages, one of the main ones is physical injury. We are dealing with animals and we cannot communicate with them. So, when they come in to see us, they don't know if we're trying to kill them or help them. And they're scared. And we can't tell them that everything is going to be okay. So, we can get hurt because they're going to defend themselves. And you get bit and scratched and stepped on, and it's just that's the nature of working with animals, is that you can get hurt, and people have and do go to the hospital because they've been injured by the animals that they work with. The next one is not really a shocker, but it's low income. You don't get paid a lot to be a vet tech. And this kind of goes hand in hand with vet techs feeling underappreciated. I said we do a lot. We are very versatile, and I could talk all day about everything that I do in a day and how it is someone else's job and that's what they do full time, and I do it. um but it really just comes down to you do a lot and you don't really feel appreciated within this space. Is this changing? Absolutely. Not everywhere you work is going to make you feel underappreciated, but a lot of people equate appreciation to income, and a vet tech does not make a ton of money. Livable wage? Absolutely, but you're not going to get rich doing it. So you have to find other ways to feel appreciated and fulfilled than just money, because if that's what you're looking for, being a vet tech is probably not for you. Uh, the other thing would be work life balance. Vet techs tend to work shift work. Uh, if you get lucky, sometimes you're working at a vet clinic that's open really good hours, but you do work evenings, you do work weekends. I mean, animals, they don't stop getting hurt or sick just because it's a weekend or an evening or in the middle of the night. And they need vet techs to work those hours, just like they need vets to work those hours. So sometimes it can be really hard to have a work life balance because you're working very odd hours. Another thing that is a bit of a bummer is we deal with a lot of death. And working in any healthcare, really, you deal with death. But something that's unique to the veterinary space and is becoming a part of the human space is euthanasia. You want to think that it's not going to have an impact on you or you can avoid it, and you just really can't. It's entwined in the job, but it doesn't have to always be bad, because sometimes euthanasia can be a gift, and it will never be easy, but sometimes it is beautiful. And I could do an entire podcast just talking about euthanasia, uh, but it makes the job hard. And so that one is probably one of the hardest to deal with, because it's not just the pet, it's the families as well. And so it really has an impact on you. Only two more. um, One is abuse from owners. So we're dealing with family members, we're dealing with money. Uh, Oftentimes there is a level of grief or stress that comes from the owners because their family member is involved. And as vet techs, you get the brunt of it. The vets get it too. The front staff gets it too. People express their grief or heartache in a lot of ways, and you're often the one who gets hit the hardest. And that can be really hard to deal with when you have an owner yelling at you and telling you that you don't care and that you're only in it for the money and that you're heartless and all of this, when meanwhile you have stayed up all night worrying about their pet, spending all day making sure that their pet is comfortable and getting their treatments and doing everything you can to help them, and the owners don't seem very appreciative. It it's not a secret that you have to be emotionally and mentally fit to work this job, but that's one of the downsides. And I don't really know of any healthcare worker that doesn't get, some abuse coming from people, because emotions are high and people throw emotions around when they're hurting. The next one brings me kind of all encompasses everything. It's compassion fatigue. So, what is compassion fatigue? It is an indifference to charitable appeals on behalf of those who are suffering. And this is often due to the frequency or number of these appeals. To say it in another way, you care so much so often that you stop caring. This term, compassion fatigue, is rampant in this field. And I don't want it to deter anyone or make anyone feel sorry for us, but it is so important that you're aware of it because it's the reason for burnout and part of the reason why we have such a high suicide rate within our field. So, while I don't want anyone to pity us because of it, because we choose to be here and we work through this, it is the heaviest part of the job is caring so much that you now have nothing left to give. So it's one of the biggest downsides. Luckily, now there are a lot of things that are supportive because we know that this exists within our field and there's lots of ways to support people. And, we have people who are specializing in veterinary social work and it's just becoming more known. And so hopefully we'll see a drop in that suicide rate and the mental health of people getting a bit better. But all right, done with the disadvantages. Moving on. Advantages. Here we go. So best advantage, we get to work with animals. It's amazing. They're amazing. It's so much fun. Um, it's a very challenging job too. So you're constantly learning and it's not a repetitive job. There's so much variety. It's super interesting. So the challenge is always there. You never know what's going to walk through that door and it really makes you use your brain. I don't think even when I worked in GP, I really don't think there was a day that there wasn't something that came through that made me really have to think or, that wasn't kind of pushing my boundaries a little bit of knowledge. I mean, the next thing is it can be exciting. Now, this one to me is a little bit based on personality. Um, if you got to be a little bit of a thrill seeker because it can be a very high stress, high reward job and very fast pace, that kind of thing, which to me makes it exciting. Like I said, you don't know what's going to come in through that door. And so it can be, while you don't want to wish anything ill on an animal, that doesn't stop them from getting hurt. And watching an animal who, say, is very sick or maybe got hit by a car come in and you're part of healing that animal, gosh, that rush can be, so thrilling because you're just working at the most optimal level and you're helping this animal at the same time. And while some people may judge me and say, oh, you get a thrill out of sick or hurt animals, maybe that's so, but it's because I want to help them so badly. And you have to like what you do. People who don't like what they do are not going to do a good job at it. So if you are hating every aspect of the fact that you help sick animals, then what's your motivation to do well at it? It's interesting to me to be able to help these animals and get them from, very sick to thriving. It's amazing, which makes it fun. So, yeah, I do like that part of the job that it's high stress, high reward, and you get to see a lot. You get to work with lots of different animals if you choose that route. So, where I used to work, there was an MRI and a CT, and you got to do all these different procedures, which makes it fun because it's so in depth and so unique. And I also worked in wildlife. So, depending upon where you go, it's super fun. And you get to work with a lot of good people too. And so the main thing that drives most vet techs, and it's kind of all encompassing of the things that I just said, are it's extremely fulfilling. When you get to, you know, heal that pet or, help a family, give them hope, even, it's just so incredibly fulfilling. Just amazing to watch what the animal body can do, just the body in general. Like it's incredible. And you really do get to change lives at times and impact people in a way that they maybe never would have had if it wasn't for you. And that is so heart filling and amazing. So the job is extremely fulfilling. And yeah, I just love it. Okay. So I just want to go over what kind of jobs a vet tech can work. I'm going to go over this quickly. So basically, you can do in clinic work. That's what most vet techs do, but there's a wide range of this. So you can work in a general practice, you can work in an emergency hospital, you can work in a referral hospital that does specialties like internal medicine and surgery and neurology and that kind of stuff. Some vet techs even work in shelter medicine, so working at, for lack of a better word, the pound or a shelter for rescuing animals. You can work in large animal, so with feed animals like cows and pigs and that kind of thing, or horses. You can work in exotics, so doing like parrots and snakes and guinea pigs and chinchillas and ferrets and that kind of stuff. Or wildlife rehab and wild animals zoo. We're going to zoo, so working with all the wild animals, you can absolutely go down that road too. So those are all kind of in clinic vet tech jobs. But we're also qualified to do other things like working for pharmaceutical companies on multiple levels. You could work as a sales rep, you could work within research, you can do a lot of things within the pharmaceutical companies. And, oftentimes people will want to make a shift in their job and not want to leave the field. So they'll go in and get kind of more of a desk job, which can be, more suitable for family life, especially. And the pharmaceutical companies do tend to compensate a little bit better. So that can be a motivation as well. But yeah, another one is pet food companies. So, like me, I work for, I consult for pet food companies because I have a specialty. So, we can do that to try and, put our, make sure that our knowledge can help within that field as well. Can also do pet insurance. So they work for the insurance companies, helping to look at cases to see, what was done, what medical jargon, and that kind of thing. Um, and they can work in a laboratory. So, like I was saying, where the blood can be sent out somewhere, vet techs can be the ones working at those laboratories, like IDEX or Antec, that run those tests. And then you could also work in research. So, companies that do research with animals often have a vet tech taking care of their colonies. So, kind of a controversial one, but the reality is vet techs are qualified to take care of the colonies, and they do. Okay, guys, I know this has kind of been a lot, and I'm not exactly a fan of just like talking at you. I'm not really suited for like lecture type styles, but I have one more thing to go over, and hopefully, yeah. Okay, bear with me, guys. Um, so, what is a veterinary technician specialist? That's what I am. What does it take to become one, and what makes you different? So, uh, I'm going to go over what it took for me to become one. Every academy has their own rules and regulations and requirements for what it takes to be credentialed within that academy. I do not know all the requirements for everyone. Um, so I'm just going to go over what I had to do. But for the most part, we all kind of have the same level of requirements because we all share the VTS designation. It's just, what's next to that VTS, whether it's nutrition or surgery or whatever, that varies. So we all want to be held to a high standard. So for me, I had to have 3+ years experience just as a licensed veterinary technician, or for me, I'm registered, so an RVT. Within those 3 years, I had to have 3 years working within the field of just nutrition or just the specialties. So most techs are not going to be able to be eligible, within that first 3 years. They're going to have more experience than 3 years of working in just nutrition or surgery or whatever. Because the chances of you getting into a specialty like that and just working full hours right from the get go, from graduation, probably unlikely. So you have to have the hours working just within your specialty for a designated amount of time. And that will vary across all the different academies. You also have to do a certain amount of continuing education hours within your specialty. For me, it was 40 hours of continuing education in just nutrition. It had to be completed within the last 3 years, and 10 hours of that had to be completed within my application year. So 40 hours is a lot. It's a lot of sitting and listening. And so, yeah, it's a hefty amount. So these were things that you kind of you have to like prepare for. You can't just decide on a whim that you want to become a VTS. You have to be a tech for a while. You have to make sure you've been working in the field for a while. You got to have a little bit of foresight to be able to do it. So once you meet the credentials to be able to apply, then most academies will have an advanced skills list that you will need to master or complete in order for them to accept your application. They will also maybe have a knowledge base that you need to prove that you have understanding of. And all these things need to be vouched for or backed by a veterinary technician specialist in your field, a vet, or a vet specialist in your field who can vouch for your performance and sign off on these things to say that they have seen that you have mastered them, not just performed them, mastered them. Like you have this skill down pat and can do it at any time whenever needed. The next thing that you need to do is 40 plus case logs, cross referencing your advanced skills. So basically, this is taking real life animals, looking at their treatment plan and everything, and seeing that they include the skills that you need to prove that you know what you're doing. And then you report on it to show that you have completed these skills with this patient. And then from those case logs, you write, I had to do 5, but other academies might have different numbers, detailed case reports describing in detail how you were involved in their treatment and the things that you did in their treatment. It's basically to demonstrate that you know what you're doing and you understand, why these are important. Why would you do this treatment? Why would you calculate this way? Why would you, in my case, pick this diet? All of that. And then you also need 2 letters of recommendation or more. I don't know what the other academies are, but I needed 2 letters of recommendation. So you take all this stuff, you package it up, you send it to the board. They go over it and look at it. And, I'm sure they have some sort of rubric or whatever that they're making sure that you complete everything. And it's pretty intense. Like you can't have spelling mistakes. You can't, like, if you forget something in your package, you cannot hand it in later. It's really strict and rigorous, as it should be. And so they look at it and then they decide whether or not they're going to accept your application. If they accept your application, then you are eligible to sit for the boarded exam. And then you have to pass that boarded exam. So a lot of the time you'll take this exam. It's because of COVID now, things have kind of shifted where you can be remote to take these exams. But before, you typically had to attend a conference and sit for the exam, and then you have to pass the exam. And once you pass the exam, then you are accredited with the Veterinary Technician Specialist, or VTS. So it's a lot. It's all self-led. You don't apply to a school. It's not like a master's program. You do this all on your own. It's your own motivation and using your own tools and everything. Yes, you have help from, they'll sometimes assign you a mentor, or you have help from the veterinarian or vet tech that's supporting you. But for the most part, like, you have to make sure that you get all these things. So I'm just going to cover, what specialties that this is in, because this is kind of an up and coming thing. Like, people are starting to really want to become specialized. So for those of you who don't kind of know the areas, I'm going to go over them, and I hope I got them all. I did get them from the NAPTA website, but if I forgot one, I'm really sorry. So I can get a VTS in behavior, anesthesia and analgesia, surgery, clinical practice, emergency and critical care, internal medicine, which divides into some subcategories like cardio, neuro, and that kind of thing, dermatology, dentistry, pathology, ophthalmology, radiology, physical therapy, zoology, and large animal. So there's lots of different areas that you could get specialized in, and there are lots of vet techs out there that have more than one specialty. So they're not just a VTS in one, they're a VTS in multiple. So it's pretty impressive anytime I meet somebody like that. Um, Getting my VTS almost killed me because it was so much stress. But yeah, it was well worth it. So yeah, that pretty much covers everything about our vet techs. Let us know if you have any other questions that I didn't cover. But for the most part, that's why we're so important. So we're not just vet techs, we're lots of things. And honestly, it's us that, are really caring for your animals. Not that the veterinarians don't, but we are the frontline workers. We're the ones who are making that comfy bed and doing the monitoring for anesthesia and keeping your pet safe. So I hope this gives you a little bit more insight as to what it is that we do and how we are different from veterinarians and different from nurses and the same as nurses in some ways as well. So thank you so much for joining us here on the Guaranteed Analysis podcast and trusting us to provide nourishing insights on companion animal health and wellness. We appreciate each and every one of you for joining us on this journey. If you liked our vibe, please follow us and share the episode with your friends and family. Until next time, may your days be filled with meaningful connections, heavy purrs, and wagging tails. Stay kind, everyone.